Hello everyone, my name is KimEH. Let us start the presentation today. These are the lists of today's literatures. The first literature is about cross-cultural perception of female facial appearance, a multi-ethnic and multi-center study written by Vogeli. Introduction. Humans extract and use information from the face in assessments of physical appearance. Previous research indicates high agreement about facial attractiveness within and between cultures. However, the use of a narrow age range for facial stimuli limitations due to unidirectional cross-cultural comparisons and technical challenges have prevented definitive conclusions about the universality of face perception. The aim of the study is to investigate cross-cultural assessments of female facial age, attractiveness, and health in a multi-ethnic and multi-center study in which female and male individuals identifying with one of 5 ethnicities. Materials and methods. Facial images and rating data were secured in 5 locations using the same experimental equipment and protocol. Data collection for image recording and image rating was done. For this study, 526 women participants were recruited through local agencies and imaged. Each sample included participants from 5 age cohorts. Facial skin tone of women varied from darkly pigmented to lightly pigmented, as skin pigmentation correlates with latitude and ultraviolet radiation intensity. On the day before imaging, no facial cosmetic or dermatological products were allowed. Participants wore identical black hairbands and black capes to cover features that might affect facial assessments. Their faces were imaged in front view, with eyes open and with a neutral facial expression using the color face system. For the presentation of the rating study, ear plugs were digitally removed from images. Eyes were vertically aligned and visible area of the neck was standardized across images. A sample of 600 volunteers, 299 females, assessors, participated in the rating study. They were recruited through local agencies in the same where the facial images of women were recorded. A subset of 180 images was selected for presentation in the rating study. Image selection was randomly stratified for participants to assess their ethnicity, gender, and the 3 assessor age groups. Thus, of the available set of images, 36 images per ethnicity were assigned to female and male assessors of 3 age groups by considering all possible factor combinations. Participants judged the images for age, health, and attractiveness in monadic presentation design. Each assessor judged 90 randomly selected facial images per attitude, balanced across age groups. Assessments of the 3 attributes were made in 3 separate blocks using web-based software. After the statistical analysis, across assessor ethnicities, patterns of facial age perception were similar. Chinese faces were judged youngest and French faces oldest, with mean assessments varying across assessor ethnicities. This table reports the main effects and interactions of assessor ethnicity, assessor gender, and face ethnicity on perception of facial age. The 3-way interaction of assessor ethnicity with assessor gender and face ethnicity and perception of facial age was not significant. Attractiveness assessments showed considerable variation across assessor ethnicity and face ethnicity, including the interaction of two effects and a three-way interaction including assessor gender. South African assessors, however, provided the highest attractiveness ratings for Indian faces and lowest ratings for French faces, with these two ethnicities showing the only significant difference. The three-way interaction of assessor ethnicity to face ethnicity to gender indicated that gender differences in mean attractiveness assessments did not generalize across assessor to face ethnicity combinations. For health, assessment showed main effects of assessor ethnicity and assessor gender, but just failed to reach significance for face ethnicity. The three-way interaction of assessor ethnicity to face ethnicity to gender suggests some differences depend on face ethnicity. The rank order of face assessments across ethnicities was the same for female and male Chinese and Japanese assessors. Discussions. Linear mixed model analysis revealed main and interaction effects of assessor ethnicity, assessor gender, and photographed participant ethnicity on age, attractiveness, and health assessments. Thus, differences in judgments of female facial appearance depend on the ethnicity of the photographed person, the ethnicity of the assessor, and whether the assessor is female or male. Facial age assessments correlated negatively with attractiveness and health assessments. Collectively, these findings provide evidence of cross-cultural variation in assessments of age and even more of attractiveness and health, indicating plasticity in perception of female facial appearance across cultures. Although the decline in attractiveness and health assessments with age is universally found. The second literature is about comparison of facial proportions between Eastern and Western attractive young women. Introduction. In a large number of the literature, the standards of beauty of different races have been suggested. So far, however, objective evidence about the difference between the Eastern and Western concepts of beauty is insufficient. One of the reasons may be varied perception of attractiveness. To overcome these obstacles in this study, the authors analyzed beauty pageant contestants using a 3D photogrammetric analysis tool, and the data are expected to contribute to the clinical practice of plastic surgeons. All of the photographs were taken with 3D photography between October and November 2016 in Seoul, Korea. The subjects were 43 attractive young Eastern women as Group 1 and 22 attractive young Western women as Group 2. All of them participated and were evaluated with 3D photogrammetry. 3D photographs of the participants were taken with a Morpheus 3D light-emitting diode-based wide-structured light scanner. The images were automatically reoriented after the 3D reconstruction of the facial image by merging these scans. 27 facial soft tissue landmarks of each participant were marked. Horizontal plane, sagittal plane, coronal plane were oriented, and the facial proportions, including absolute lengths, angles, proportions of facial volumes, and vertical and horizontal lengths between each facial landmark were analyzed. Statistical analyses were performed with SPSS 24.0 program. These are the results about absolute length and angle. The heights of the face except H2 lower were statistically significantly longer in Group 1 than Group 2. Among the height of facial structures, H2 nose and H2 eye were found to be statistically significantly larger in Group 1. W2 facial, W2 lower facial, and W2 intercanthal were statistically significantly wider in Group 1. With regard to angles, Group 1 was estimated to be significantly statistically wider in A to nasofrontal, A to labiomental, and A to nasomental. A nasolabial was not significantly statistically different between the two groups. Only P2 lower facial index appears significant difference between two groups in statistical analysis of length proportion. There were significant differences in the statistical comparison of all the measurements of width proportion. Discussions. Facial attractiveness has been found to be important in interpersonal communication and social relationships and can even have a greater effect on a person's success. However, the perception of beauty is quite subjective. Beauty is defined differently in the East and the West. In spite of a large amount of literature, to the best of our knowledge, there has not yet been research to suggest the objective ideal model of attractive face. From the results of this study, the authors could suggest the most reliable reference data for the characteristics of what is considered an attractive face in Eastern and Western countries. Furthermore, by comparison of the data, the authors proved the objective differences between Eastern and the Western concepts of beauty, which previously had only been recognized ambiguously. This study is expected to provide useful information for plastic surgeons in establishing surgical plans and performing plastic surgery in the clinical field. Let's move to the third literature. It's about comparison of facial aesthetic standards between Latin American and Asian populations using 3D stereophotogrammetric analysis. Introduction. Good facial appearance differs between ethnic groups. The aim of the study is to compare facial aesthetic standards Paraguayan versus Korean beauty pageant contestants and evaluate the deviation in focus proportion indexes using three-dimensional stereophotogrammetric analysis. Materials and methods. 3D soft tissue images of 34 Miss Paraguay MP and 54 Miss Korean as known MK pageant contestants were obtained. The 3D images were digitized and 52 measurements and ratios were calculated. The 3 scans were registered into a 3D model and tracing landmarks were added to the 3D models by Morpheus 3D dental solution. Redirection of the position of the head and the design of a 3-dimensional coordinate system was done. The origin point of the 3D coordinate system was established. Linear measurements were assessed and the blend-Altman method was applied to assess the minimal detectable differences. The sample size was calculated based on a previous study on facial form and lip position in Korean and European American female adults, using a 1.15 level and a power of 80%. It showed that at least 33 subjects were required per each group. One-way multivariate analysis of variance was applied to compare the two groups. One sample t-test was applied to assess the differences between the PI of each group and the golden ratio. These are the results. The MK and MP groups had no significant differences between the right and left side. Despite the considerable variation among individuals in both groups on average, the MP group had smaller interendocanthus width, facial width, total facial height, forehead height, and nasal height than the MK group. However, the MK group showed smaller mouth width, ear height, and lower lip protrusion than the MP group. For these variables, there was a considerable variation among the individuals. However, on average, the MP group had a larger horizontal forehead curve and horizontal and vertical chin curves than the MK group. Meanwhile, the MK group showed a larger vertical forehead curve and vertical cheek curve. The MK group had smaller upper and lower vermilion areas and a total vermilion perimeter than those of the MP group. However, there was no significant difference in volumetric measurements except for the volume of the upper portion of the face, which was greater in the MK group than in the MP group. Canons and PIs showed considerable variation among individuals. However, on average, all canons showed significant differences between the groups except canons 1 and 8. Also, all canons showed significant differences from the traditional values except canons 4 and 6 of the MK group and canon 7 of the MP group. All FICA's PIs in both groups showed significant differences from the golden ratio except PI19, its upper to lower vermilion heights. From our results, it may be claimed that most Latin American individuals, in general, prefer rectangular faces with wide mouths and large lips, especially the lower lips, whereas in general, most Asian individuals prefer long tapered faces with small mouths and lips. Unfortunately, our study focused only on an analysis of the soft tissue measurements without any assessment of the skeletal dimensions. Further studies are recommended to evaluate dental-alveolar relationships to soft tissue variables using cone-beam computed tomography for the assessment of facial aesthetics of beauty models. These are the conclusions. Ethnic groups have different preferences in aesthetic standards. Paraguayan individuals favor rectangular faces with wide mouths and large lips, especially lower lips, whereas Korean individuals prefer long tapered faces with small mouths and lips. Most of the traditional characteristics for facial beauty, such as the golden ratio and neoclassical canons, were different from the current criterion for facial aesthetics in both groups. Therefore, it might be advisable for clinicians to consider ethnic differences in facial aesthetics during diagnosis and treatment planning. Thank you for listening.